Good afternoon, everyone. Thank you for joining us today with the Edson College of Nursing and Health Innovation College Assembly. Welcome. We're so excited that you're here at Arizona State University and enjoying today's event. Today, during this session, we have some of our faculty members from our health program. And each of our faculty members is going to take a turn talking about our undergraduate baccalaureate, what we call our baccalaureate health degrees. And all of our programs, we have nursing, but we also have many other health programs. And you'll find that most of the students in our college are pursuing majors in our health programs. So today you will hear from Dr. Janet Marr, Dr. Mike Collins, and Mary Small. And I am Nancy Kiernan. I work with the student advising, engagement, and our admissions team. So we're the advisors and staff that work with you with registration, enrollment, and any academic issues you have or interests that you have during your time here in the Edson College. Today, we're going to highlight our undergraduate health programs, which include our Integrative Health, Healthcare Compliance and Regulations, Healthcare Coordination, Health Entrepreneurship and Innovation, and Integrative Health. All of our programs are offered on the downtown campus as well as through our ASU Online program. And we do have some programs noted with the asterisks that are offered at ASU West. So I'm going to pass the mic over to Dr. Janet Marr to tell us about some of our very cool and popular programs.
Welcome, everybody. I'm so glad you're here. Hope you're excited to be back on campus or virtual. So we have 3 programs in the baccalaureate health program. They're all very patient focused, working with patients, but not in the hands-on sense of what a nurse would be doing. So the first program is the Integrative Health program, and this covers all those modalities that are considered complementary to medical practice, non-traditional methods. This includes things like yoga, acupuncture, massage, other body work areas, meditation. So these are all have been researched and are evidence-based nowadays in the Integrative Health program. And along with learning about these modalities, you won't actually learn how to do them or get licensed in them, but you'll learn about their history and how they work. And you'll learn also about legal, ethical issues, the historical and cultural foundations of integrative health. Many of these systems like Ayurveda and Chinese medicine go back way, way, way back to a different time. Did I mute myself? Sorry. Most of the students that I have taught have been going on to be wanting to become chiropractors, naturopathic doctors, some people going into physical therapy. All these different other alternative health programs go through this bachelor's program to become a get their training and go on to an advanced practice as a healthcare provider in like acupuncture, chiropractic, naturopathy, and many other things. So it's a pretty exciting program. I think I'm a certified teacher and I practice a lot of these techniques for myself, and they've been very helpful in dealing with the pandemic and staying centered and focused and balanced. So the next program we have of study is community health, and this is the largest one in our program. This prepares students to work in the community, to work with maybe at-risk populations, people with low socioeconomic status, patients recently released from incarceration. And these are the folks that work in the county health departments, free clinics, maybe even develop their own nonprofit organization to fill those needs in a community that are not met within the structure of, say, a traditional hospital or doctor's office. So these people become health educators, directors of community programs. They may be evaluators or managers of programs. Like I said, they may work with formerly incarcerated peoples. And they take classes. One of the most popular classes, I think, is the environmental community health class and needs assessment. Also learning about program development and management are important skills to have in this area. So if you're interested in being an advocate and working with your community to make it a better place for those who maybe don't have excellent healthcare insurance, and that this is a good place to be, I think. And the last program in our program is the healthcare coordination. I also teach some of these classes, and this gets you in more with the individual and their caregiver or family. And it originally started as navigating through the healthcare system for patients that have cancer, because their treatment after they're released from the hospital could be very complex with multiple appointments for doctors, imaging, meeting with oncologists, having lab work done for chemotherapy. So the original healthcare coordinators were nurses that helped navigate patients through the system. So our graduates work in a variety of places. You can get a job within a hospital, a doctor's office, a clinic. Some people have gone on to work with insurance companies. You could also work within an accountable care organization or other care management groups, chronic disease management. There is a huge need for people to have help navigating through the healthcare system. And these, like I said, it's not hands-on, but it's also knowing about the resources in the community, knowing about health insurance, and being able to educate patient and family, and also being an advocate for them. And so you'll be taking classes about health legislation and policy, once again, social determinants of health and professional development in learning how to structure your resume and developing some leadership skills. So I think we've got 3 really good programs here if you want to be involved with patient care, but not, like I say, hands-on care like a nurse would provide. But these are definitely needed people within our complex healthcare system. So I'll turn it over to the next speaker.
Hey everyone, I'm Dr. Mike Collins, and I help oversee the Health Entrepreneurship and Innovation degree here at Arizona State University. First of all, welcome. Innovation is always changing what's around us. Innovation is looking at things and asking the questions, can we do it faster, safer, cheaper, better? There's been some amazing, innovations just in your time, and, whoever thought that you could, carry a computer in your pocket, or, just the changes that we've seen with the pandemic are pretty amazing. Sometimes innovation could be pretty simple, like wearing a face mask for prevention. Sometimes they could be more important, like, thermometers and getting your temperature taken. Like, who all thought that we'd have a thermometer, every time we walked into a building. But our innovation program is really looking, to what can we do better? How can we do it better? Healthcare's been, pretty stagnant for a long period of time. The pandemic's shown a lot of weaknesses in the healthcare system, and innovation is needed in order to get the care that we need to the people that need it. A great example of that is when Ford Motor Company needed to stop making production of the Ford F-150 pickup and start making ventilators for the hospitals. Like, who ever thought that that could be something that could be done? But it took someone with an innovative idea, an innovative mindset to think, hey, look, we can take these parts and pieces that we use for this, move them over into a healthcare world, and really start making a difference for those who need it. And I always like innovation as a way of thinking, like, if you if you love the status quo, if you like following the rules, if you, you know, Mary's going to talk to you next about a great program. We're like those color out the box, color outside the line. You know, why do we always have to do it this way? Those are the students that make excellent innovators. You know, that we need the Elon Musks and the Steve Jobs of healthcare. And it's a great program. It's a lot of fun. A lot of times students come with us with these ideas, and, you know, we look at them and just like, why didn't I think of that? You know, how amazing is it? So our program is a very unique program, first of the kind in this nation. Everyone's going to get a chance to, through ASU 101, to kind of work on a little bit of an innovative idea, an innovative project, and see how that project can expand. We have awards for students at the end of the project to, if it's a great project and it's something that people think it's interested in. We also have a contest where you can earn money and launch your program. So we're here 100% to help you. Healthcare innovators are people who you can work as a healthcare administrator, an entrepreneur to start your own business in healthcare, selling to hospitals, selling to clinics, selling to app stores. If you come up with a great healthcare app, project managers, software developers, it all comes in, as long as it's got a healthcare spin to it, it's all part of our healthcare innovation program. So great program, great students, a lot of fun. We bring in a lot of people from the community who have done exactly this, who have kind of broken the mold and stepped outside of the healthcare system to create better ways. And you know, it's a fun program. No 2 days are the same. It's constantly changing. Everything we taught last year about healthcare is now different with the pandemic. So, you know, now these new innovative ideas are far surpassed what we even imagined. So, you know, great program, great students, and phenomenal faculty. Most of our faculty are still working in the field. So, again, I'm Dr. Mike Collins. If you have any questions, 100% here for you, and welcome to ASU.
Hi, I'm Mary Small, and I'm going to talk to you about compliance. We're the people who follow the rules. No, actually, we are the people who help ensure that other folks have been following the rules. And within the organizations of healthcare and within the many, many arms of the healthcare continuum, so we're talking providers, insurers, regulators, consultants, vendors, you know, networks of different types of providers. There's a lot of opportunity for things to go wrong, and each of those segments have their own set of regulations to follow. So it's extremely complex and mistakes can be made. But let's talk for a moment about fraud, waste, and abuse. Being that it's so complex, there's a lot of nefarious players in the industry trying to take advantage of some of those complexities and looking for loopholes. So regulators are always doing audits and investigations, and compliance has a big part to play in helping to ensure that the organizations that we are employed in or associate with have the good tools in order to be able to ensure that they have compliance nailed down and that nefarious players are not within their organizations. So within this major, you're going to have some courses in project management, accounting and billing, licensure, monitoring and auditing, fraud investigations, data security and privacy, corrections, and preventative actions. You're also going to have a capstone at the end, which helps you bring all of this together. One thing that I do want to say is this degree is the only undergraduate degree. All the other degrees in the country are at the master's level. So it is cutting edge for us to be doing this degree. It's been up and running for a number of years. We have graduates coming out that are working in healthcare or in insurers or in regulators. So we're very excited about, as we're growing, we brought in an external advisory team with insurers, regulators, and providers. We're going to be bringing in some of the other parts of the industry as well. But right now, those three some of them will be faculty associates in your class. So that these are external advisors that we meet with to help understand where the job-ready skills are needed. So we're looking forward to having you be able to develop some sort of career path. Some of it will be going on. You might want to go on for your master's through the law school, or go through a research degree, which is going to be in Edson. If you want to work in research, that's a whole different set of regulations. So, but then there's also those who want to just start out as a compliance associate or a compliance specialist. And we would love to see you just grow in your career. So as you see below, there's a number of things here that you could get involved with pretty much right out of the gate. You wouldn't be a privacy officer right out of the gate, but you could work in a privacy department and learn skills to become a privacy officer. So again, ultimately, a lot of compliance officers, if you take a look at healthcare, have built over some of these skills over a long career, and we're looking to help you begin your path if you're interested in such a profession. So welcome, we're glad you're here. Thank you.
Thank you so much to our faculty today. As a reminder, some of what you've heard in other presentations, we encourage you to get involved in clubs and organizations. We have many that are affiliated with our college and our programs, like a health innovation club that we have, that the students have formed for students interested in learning more about entrepreneurship and innovation. So take a look at the student clubs and orgs that are available and all the events and activities that are going on during Welcome Week. Thank you again to our faculty presenters that joined us here today. And if you do have any questions, please put them in the chat before we end our session today. And as a reminder, the advising team in the Mercado on the downtown campus and in the Fab building on the West campus, we're all available to assist you. We're also available via phone, Zoom, email, whatever way you need to reach us, we'll be here for you to help you through these first weeks of classes. Thank you and enjoy the rest of your day.